In this video, we'll talk about touch and how to use touch with clients. Now, as you may be aware, many therapists never touch their clients, and it really, a big part of that depends on what kind of clients you really work with. If you're working with clients, really severe clients who tend to be hospitalized, inpatient, kind of, stays in a psychiatric hospital, that kind of thing, you'd have to be very careful with the use of touch, and you may decide just that you never would use it. I don't tend to work with clients that are that severe, and in this demonstration video, the session, Sandtray session with my wife Debbie, what you'll see in this clip that I'm going to show you here in a minute, that is in part one of that session, what you'll see is how I would typically use it. About 5 minutes into the part one video, Debbie is crying, and I touch her shoulder really mainly to show that I'm there with her. And that's something many therapists wouldn't do, but it is something I do as a way to convey empathy. In my book, Sandtray Therapy, a Humanistic Approach, I talk about the issue of touch at some length in that book. But in this video, let's focus on it briefly for a moment. In the DVD that comes with the book, I touch the client in that session, and I touch Debbie in this video because, as I said earlier, it's one of the best ways I know of to convey a meaningful type of support when clients are feeling significant pain, sadness, or possibly fear. Let's look at this segment where I touch her. We'll look at a little bit right before it, and the segment isn't long. So let's watch it. Look at this segment of the video for just a minute, and then we'll come back. So that's you, and anything else you want to say about you?
Well, I chose this figure of a fairy, or yeah, I think that's what she is, with a magic wand, and she's missing a wing. And I like that because she's imperfect and having a hard time navigating, I think. I like the wand because I spend most of my time in my life listening to people. And hoping I can come up with some good ideas, or so the wand was sort of like giving some of those dreaded, unwanted solutions, and to people. I know people don't necessarily want that a lot of times, but I, for some reason, feel the need to help. Mm-hmm. Mm-hmm. Boy, I don't know where that comes from, but it's this deep-seated something to help and have solutions for people. So, anyway, that's why the magic wand. And
now, I'm not sure what you thought from that segment. As I mentioned earlier, there are many therapists who would not do what I just did, and as I said, partly due to the population of clients they serve. For instance, if you have clients who are sexual abuse victims, it would in all likelihood be inappropriate to touch them. I had an experience once with a client before I knew as much as I do now, when I was a little greener, and her husband was right there, but she was a victim of sexual abuse as a child, and she was feeling pretty distressed, and I touched her with her husband right there next to her. Oh, she did not like that. She does not want to be touched if she's experiencing anything that is remotely connected to that, because she has a, you know, you'd probably guess, she has a negative association that she has paired with that. So it's coded, it's a dual coding issue. That experience of touch when with certain feelings has a negative code for her. Also, with a borderline client and that kind of client who has diffuse boundaries, you probably would not want to touch the client. I do not touch clients ever unless I have a deep level of trust with that client, unless that client trusts me on a deep level. And really, I don't do Sandtray with clients unless that level of trust is there. Certainly, clinical judgment needs to be used, and if you have doubts about its appropriateness, it would probably be better not to touch the client. Touch can be a powerful way to convey empathy and support if used appropriately. If you're a student right now working on a master's degree, it would probably be better not to use touch with clients because it really requires considerable clinical judgment and clinical experience. But if you're an experienced clinician, the appropriate use of touch might be very beneficial to your clients.